If you're struggling with knee pain and you're getting nowhere with massage, taping, icing it, whatever else you might be doing, you should probably give this video a watch. I'm going to run over a load of different tips that I've learned from helping a lot of athletes and everyday people fix their knee pain and get back to doing the sport or the activity that they love doing. So let's jump straight into it. The first tip, or the first thing that you need to understand and that you should be doing with your knee pain, is we need to decrease the pain. Now, this sounds really, really obvious, but what a lot of people do is they completely rest their knee, or they stop doing anything with their knee as soon as they get any pain. And the problem with this is, to fix your knee pain, we actually need to improve your mobility, your strength, and your confidence. And as you continue to rest and not do anything, you actually start to lose all of these things. And so we need to start doing some sort of exercise to actually reduce your pain. Getting stronger will reduce your pain. Now, for a lot of people with knee pain, bending their knee straight away can be very, very painful. So what can we do to kind of solve this issue? Well, we can do a type of exercise called isometric exercises, where you hold a particular position for a long period of time. This is really good because it allows us to build strength in the early stages of rehab for the quads and hamstrings and muscles around the knee. And it also allows us to reduce pain, which will then further on in the process allow us to start to bend the knee and move it in different positions. So the first exercise that you should be doing if you've got knee pain is a foam roller bridge. This is one I give to all of my clients. So you're going to grab a foam roller, lie on your back, put both your feet flat on the foam roller, and then you're going to slightly tuck your pelvis so your lower back is flat into the floor, and then lift your hips or pelvis about 1/2 inch off the floor. In this position, your hamstrings and calves should be working really, really hard. Hold this position for as long as you find challenging, for 3 to 4 sets. You want to be aiming for between 45 to 60 seconds on the double leg to start off with. So do that exercise, 3 to 4 sets, and then jump into a single leg wall sit after that. So the foam roller bridge was looking at the hamstrings and a little bit of calf strength. The single leg wall sit is looking to build some quad strength without irritating your knee. Now, if your knee is very irritable and you've got quite a high pain score and bending the knee is very, very painful, then start nice and high on the wall. Start nice and high on the wall, and then as you get more confident, as you get stronger, as your pain decreases, then you can move down the wall every few weeks, every week, or every few months, depending on how long it takes. You want to hold this position for 45 to 60 seconds on each leg, and again, run through 3 to 4 sets. A little bit of pain is okay. So if you imagine a scale of 0 to 10, and 10 was the worst pain imaginable, and 0 was no pain, as long as you stay within that 0 to 3 out of 10 pain score range, you're absolutely fine on this. Again, to make it easier and to potentially make it less painful, move higher up the wall. To make this more difficult and increase the amount of knee bend, move further down the wall. Once you've moved down to about 90 degrees knee bend, and then to make this even more challenging, you can start to bring your heel closer to the wall to bend the knee further. Next tip that I want to stress with the knees is to not stop training the rest of your lower body. So a lot of people with knee pain, they will just rest completely as soon as they get knee pain. They won't train their hips, they won't train their calves, they won't do any other training. And this is not a great idea, because a lot of knee pain actually stems from strength issues and mobility issues in our feet and ankles, but also up at our hips. So we want to continue to train and move these areas, which will really, really help fix our knee pain, but also in the future prevent a lot of injuries. So 2 or 3 really good options to start to train the hips without aggravating the knee. Number 1 would be any version of a glute bridge or a hip thrust. You're squeezing your glutes as hard as you can into that top position. Easiest version is a double leg. Tuck that chin so you got a nice neutral spine, and then you're going to squeeze your glutes as hard as you can into that top position. About 90 degrees or a little bit less than that on the knee bend. If this is a little bit sore on the knees, then just decrease the amount of knee bend. Start off on the double leg, go through 3 to 4 sets of anywhere from 8 to 12 reps. You can load this up heavy either with a dumbbell or a kettlebell in your hip, or a barbell with a hip thrust pad if you've got that available to you. Then to make this more challenging, just go onto a single leg glute bridge. Same thing here, 3 to 4 sets, 8 to 12 reps each side. Next exercise for the glutes, but also for the adductors or the groin muscles, is a cable abduction and cable adduction. So this is really easy to set up. Grab a PVC pipe or just anything to support you. So balance isn't the limiting factor. Pop your foot into the cable attachment, and then abduction is going to be moving your leg away from you, targeting the outside of the glute. 15 reps of that, and then spin all the way around, and then pull your leg in towards you. So targeting the muscles on the inside of the leg or the groin, the adductors. 15 reps there, nice and challenging, and then swap sides. You can do that 2 to 3 sets. That's really going to get your hips feeling better, and will also translate down to how your knees feeling as well. So that's 2 exercises for the hips, calves, and the foot and ankle. Number 1 would be a straight knee calf raise. And I only want you to go from a stretch to a neutral position. So stretch position is the bottom of the calf raise, and neutral is not all the way up to the top. It's just as your foot gets back to this position. We're not going all the way up. The reason I do this is because a lot of the research shows that you can get more calf strength development and more calf hypertrophy, which is just muscle mass, if you only go from a stretch to a neutral position. Load these heavy, go for 3 to 4 sets of anywhere from 5 to 8 reps. The biggest mistake people make with calf training is they don't load it heavy enough because they think the calves aren't a powerful muscle group, and they're actually one of the most powerful and strong muscle groups in the lower body. First 2 tips, really helpful to get your pain down. Now we're also going to look at some more bits of mobility because we kind of covered a lot of strength there. So the first thing we can do mobility wise is improve your tibial rotation. Now the tibia is one of the bones in between your knee and your ankle. And if we can get that bone rotating in and out a bit more smoothly, it's going to help how the knee is feeling, because we need tibial rotation to actually bend the knee properly. We need to improve that movement. So the easiest way to do this is just to sit with your back against a wall, and then you're going to pop one of your, well, you can use one or both of your fingers just below, a little bit below your kneecap. And you want to feel the top of your tibia, and you'll know you're on it when, as you rotate your tibia, you can feel that bone kind of rotating. You're going to run through 2 to 3 sets of anywhere from 15 to 20 reps in and out with the tibia. Your foot will turn in and out as well, but it shouldn't be the prime mover. So you want to do this as slowly and controlled as you can to actively involve the tibia before the foot and ankle starts to take over. This is just going to help the knee get the knee feeling a lot better, because it's going to get blood flow in the area and get, just a lot more of a kind of smooth movement pattern in both knees. So that's kind of knee mobility. Next, we're going to look at your hips. So the simplest one to do for the hips is pelvic tilts. Lie on your back. Imagine your pelvis or your hips is a water bottle, and you're going to tip that water bottle forward so your lower back is off the floor, a little bit of an arch in your lower back, and then you're going to slowly tip it back so your lower back is flat into the floor. Once you've gone through 3 to 5 reps here and you're used to the movement, then we can incorporate some breathing as well. So as you roll that water bottle forward, inhale smoothly through your nose, and then as you roll that water bottle back and your lower back is flat into the floor, exhale smoothly through your mouth. Run through 2 to 3 sets of anywhere from 5 to 10 to 15 breaths. That's one for the hips. Another really good one for the hips is scissor slides. So you're going to lie on your side, knees at 90 degrees, feet are going to go flat on the wall. So imagine you've got paint on the bottom of your feet and they can't move. And then you're going to shift that top hip over the bottom hip. And the way you do this, as I'm demonstrating in the video, is rolling that top knee over that bottom knee, forward and then all the way back. You should feel a really nice opening sensation at your lower back around your glutes. And potentially you should also feel that top glute working really hard as you roll forward and then back. With this one, you can run through 2 to 3 sets of anywhere from 15 to 20 reps. Next, we're going to look at foot and ankle mobility, which can also be a bit of a limiting factor with knee pain, and something that if you improve can really help. So the simplest exercise to do here is a pronation drill. Pronation is an inward roll of the foot as we start to bend that knee a little bit. So you're going to set up in this position, as I'm doing, in a staggered stance. Your front leg, front foot is going to be the one we're working on, and then you'll swap sides. So you're going to maintain heel contact, maintain big toe contact, and you're going to gently encourage that knee to come forward. Don't aggressively push it right over your toe. Just encourage it to come forward and bend your knee. And I want you to try understand the sensation of inward foot pressure, or your foot pronating as you bend it, and your arch collapsing a little bit, which is okay. And then as you come out and you straighten your knee, your tibia will turn out, and you should feel the pressure in your heel and more on the outside of your foot. So this is a sensation exercise, which is really going to help loosen up the foot and ankle. So as your knee is straight, pressure is on the heel and the outside of the foot. As you slowly bend that knee, pressure is going to go more into the middle of the foot. Your arch is going to collapse a little bit, and you're going to feel it on the inside of your foot as well. Run through 2 to 3 sets of anywhere from 15 to 20 reps. In terms of frequency per week, I would start off doing the strength bits that I've mentioned 2 to 3 times a week, and the mobility bits, you can do them daily or at a minimum at least 3 times a week for all of that. Some other really important tips with knee pain that a lot of people overlook is more pain doesn't equal more damage. So if you're getting more pain on one particular day and you think you've hurt your knee more, it's probably not the case. Pain is incredibly complex, and it's influenced by a lot of different and other factors like your sleep, your nutrition, your relationships, your beliefs around what's caused your knee pain in the first place. Instead of looking at your knee pain day to day and thinking, oh, it's more painful, I might have damaged it more, you need to look at knee pain over weeks, months, and potentially years if you've been dealing with it for years, which leads on to my next point. Have realistic expectations with your knee rehab. If you've been dealing with knee pain for a few weeks, then this is good. You've attacked the issue early, and it might only take you a month or 2 to fully recover, become pain-free, be strong and mobile enough to get back to what you want to be doing. If you've had chronic knee pain for 2, 3, 4, 5 years, and you've had multiple knee surgeries and there's a load of complications, then don't expect to be fixed in 2, 3, 4 weeks. It's going to take at least 3 to 4 months to see some measurable changes, and that might not be pain-free. That might just be a stepping stone. You've got to be realistic with it and think, how long have I actually been dealing with this injury? Because your brain will get accustomed to moving in a different way to offload that tissue, and you will likely be a lot less mobile and a lot weaker on that injured side. This sounds really, really obvious, but a lot of people don't really think this through sometimes. Another really important tip that I kind of glossed over is sleep. During rehab, during training, during just day-to-day life, if you don't train a lot and you don't go to the gym that much, is making sure you're sleeping 8 to 9 hours a night. Good quality sleep. All the research supports that sleeping less than 7 hours a night increases your injury risk by up to about 60%, which is ridiculous. And obviously, everyone knows how important sleep is for recovery in terms of giving your brain time to rest and process things, but also your muscles time to recover, grow, and get stronger, get bigger. So that's really underrated. The second thing I would say is underrated is nutrition. So you want to be aiming for 1.5 grams of protein per kilo of body weight every day. That's the main standard I talk about with nutrition. The other things like amount of carbs, amount of fats, it doesn't really matter as much. Protein is really important because obviously it is a massive part of protein synthesis and getting stronger muscles and getting bigger muscles, which is obviously a big part of rehab. It's not everything, but it is significant. So I weigh about 80-ish kilos. So if we times 80 times 1.5, that's about, what is that? 80 times 1.5, it's just under 140 to 150 grams of protein per day. So I can break that down into 3 to 4 meals of between 30 to 40 grams of protein. I'm not going to go into any more detail on that because I'm not a nutritionist, but that is a really important point. If you're not sleeping 8 to 9 hours a night, a good quality sleep, and you're not eating correctly, then there is no point in doing any of these other things that I've told you with knee rehab. Another point, another really important tip is don't rush the process. Don't push through pain, and understand, like I mentioned a bit previously, You're going to have good and bad days. And when you have bad days, you need to back off on the range of motion. So the amount of movement you're doing with certain exercises, and you need to back off maybe on the amount of sets and reps you're doing. Then on good days, when your knee pain is less and you feel good, then you can push things a bit and increase the range of motion, increase the weight, increase the sets, increase the reps. This is very different to training in this sense, because training generally, we don't have that aspect of pain. If you're trying to improve your back squat, you just increase the weight every few weeks, every week by a little bit. Whereas with pain, because pain is very complex, you need to have this longer term approach. Whereas over the week, you might have like these little dips and troughs where some days you're using less weight, some days you're using more weight. But overall, we're seeing a positive trajectory upwards where your pain is decreasing, your mobility is improving, your strength is improving, your confidence is improving over the long term. So again, it's this long-term vision, as opposed to don't stress about things day to day. Record it, take note of it, but yeah, look at the long-term vision and prioritize that, especially if you've been dealing with knee pain for a long period of time. If you would like to work with me one-to-one to fix your knee pain, just check out the top link in the description.